What were the most interesting themes emerging from the panel, solutions in the healthcare system that can improve patient care?
The panel on healthcare system solutions that can improve patient care just took place here at the French Pavilion, the French Café. It was organized by the French Polish Chamber of Commerce and brought together representatives of the Ministry of Health as well as representatives of the French companies active in Poland in the field of pharma and healthcare. In terms of the key themes that emerged from the panel, let me bring up two. The first one is around the essential role of innovation in improving patient care. And the second one is around the commitment from both sides, the public sector and the companies, to explore solutions and have an open dialogue to improve care for patients. Specifically in terms of innovation, what fascinated me is how wide the span of innovation was. So we talked about scientific innovation, the drugs, of course, which is our bread and butter, our business. At the same time, we also talked about screening and diagnosis, about technology as a way to capture data and analyze data, up to innovation in regulations and systemic rules for example, allowing to assess combination treatments in oncology.
The care of spasticity patients was another topic discussed on the panel. How can things be improved for Polish patients?
Spasticity is also a symptom present in patients with multiple sclerosis, with injuries of the central nervous systems, and obviously in children with cerebral palsy even after they reach 18. So while for post-stroke patients, the best effective treatment available, which is injection of botulinum toxins directly into the spastic muscles, is available in Poland, that is not the case for other patients. And again, I mentioned multiple sclerosis patients, post-brain injury patients, as well as children past the age of 18. This gives source to some inequalities, and again, it's the same spasticity regardless of etiology, regardless of the cause. What that means is that these patients have significantly impaired quality of life. They require sometimes almost constant care, and they're not an active part of society. So expanding access to Polish patients that suffer from spasticity, not only from stroke, but from other causes as well, will mean, one, a reduction of the burden on their families, that is obvious, as well as a reduction of costs, hard costs for the healthcare system, because we're looking at a reduction of complications, and the cost of complications is significant, as we know, and we're also looking at a reduction in the cost of nursing if these patients become more independent, have better quality of life, and can be part of society and part of their families in a different way.